Hey everybody, Testicular Cancer Awareness Foundation is excited to announce the launch of The Ballroom. The Ballroom is a monthly virtual meeting where patients and survivors can meet and talk candidly with each other in a safe space. This is for patients and survivors only, so if you are a caregiver listening, let your loved one know to join in. Each meeting will have a testicular cancer expert guest to answer your questions live. For more information, click the link in the description and sign up to receive the monthly link. We hope to see you in the ballroom. The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today we're joined by Andrew Kettner. He's an active duty Marine. Andrew, thank you so much for being here.
Yeah, it's good to be here, and happy early Father's Day to you.
Thanks. You're a Marine, but you're a testicular cancer survivor. We won't talk too much about the Marines, but we'll talk about your testicular cancer. You were diagnosed with a primary mediastinal germ cell tumor, which is the first for this podcast. So I'm excited to talk about that, given the circumstances. Unfortunately, it sucks, but here we are. You're alive and kicking.
That's right.
So let's talk about who you are before we get into your testicular cancer story.
Yeah. So again, appreciate you having me on. My name is Andrew Kettner. I'm a husband, sitting at 16 years with Kate, my wife. Have three boys, 15, 12, and 10. I'm a Marine from Southern Maryland. I'm currently in Virginia. I'm an LSU fan. When it comes to football, I'm a Red Sox baseball fan and testicular cancer survivor. I wouldn't have guessed that a year ago that I'd even be in this situation, but here we are.
As a Red Sox fan, I hope you're going to join us at our conference in Boston this September.
I know it's coming up, and I'm started laying the groundwork with Kate to make sure I have enough money in the bank with her so that she'll let me go.
Perfect. Well, hopefully you can make it.
Yeah.
Let's talk about what led up to your diagnosis. So as a primary mediastinal germ cell tumor, your symptoms may have been different than, the average guy finding a lump on their testicle. So what was it that you noticed?
I remember the feelings now. This is August last year. I'm 40 years old. I just turned 40 August 21st of last year. And as a Marine, and I think just anyone that's in shape, you kind of have a feel for your body. And it was shortly after my birthday, I started feeling slower. My long runs, I felt like I wasn't hitting the numbers I hit before. And at the same time, what I didn't know later on was a shortness of breath. So as I was running, I just couldn't take in a full breath. Now I've described it as a door that's opening, but there's a door stopper. So I combined with this, I'm getting slower. My lung can't expand all the way. I'm kind of pushing it off as old age. I'm 40 years old now. Maybe this is what it means to be a little bit older. But when I would go upstairs, just walking up the stairs, I'd start to feel my heart beating pretty heavily. I wouldn't say palpitations. I haven't gotten that anywhere in a diagnosis, but I felt a flutter. And that would happen randomly throughout the day. I had a pretty bad cold that occurred early September, mid-September. I'm still pushing off this feeling that it's not anything big. I go to Australia on a work trip. And while I'm over there, I'm feeling it even more. So it's just this gradual increase of I'm slower, it's harder to breathe, and my heart seems to be like I'm drinking too much coffee. Those two symptoms, there was no pain, no pain in my testicular groin area. Those two symptoms are ultimately what was probably 80% of the reason I went to the ER for October.
Wow, that's terrifying. So what, I guess, was it just, that it had progressed by the time you got to Australia, or was it something like with the cabin pressure of the airplane, or, what kind of made it, did they know what made it worse when you got there?
No, it's when I was, and this was again with just me, I was still running regularly. I was still working out, and I could feel less and less ability to take in full breaths. And when I got back home, I took a day or two off of work with jet lag, and it was a friend of mine who texted me. This was October 4th, texted me in the morning. I work at the Pentagon. So I'm holding up my uniform bag at the front door that's right over there. And he texted me saying, hey, I'm not going to be able to come in this morning. I got a medical appointment. And I just kind of stopped and I said, I texted him back, I'm going to go. I didn't think it was going to unfold into all of this, but I knew there was something wrong and it had been wrong for a while. I don't think there was anything in particular that the aircraft pressure or anything caused. It was just happenstance and coincidence that a friend of mine was going and something clicked in my mind that maybe I should go.
Yeah. Hey, it not necessarily had to be that. I asked dumb questions and I don't know, but, all right. So when you finally went to the doctor, was testicular cancer something that you had even thought of with the, chest, the breathing stuff? Or, what were you thinking?
No, I went in thinking that it was some infection from that cold I had mid-September. It was a pretty bad one. I even slept on the couch because I didn't want to wake up my family upstairs. And I just assumed that there was something in reference to that, in relation to that. So I went in and I was just having trouble breathing. That's what I called it at the time. Now looking back at it, it was probably more of a shortness of breath. And that took me into the ER, and I explained the heart and the breathing issue. And I even think that initial triaging that I went through maybe was supporting that those first hour or two when I was at the ER. Because cancer writ large wasn't something I was considering, particularly back October last year. I've had some issues before with testicular cancer, not issues of having cancer, but I would feel like I had a sports hernia many, many years ago. And I remember then, this was decades plus ago, I was like, maybe this was back then, maybe I got to look into this, but it went away over time and it got checked out. It was legit just a hernia, a sports hernia. So no, I wasn't thinking it at all when it came to this.
So what was your path of testing that led to the testicular cancer diagnosis?
Okay. So I go to the ER. The ER does some ultrasounds on me. They note that I don't have any fluid in my pericardium. There's a sac around your heart. There's areas that fluid can come together and then cause some pressure on your heart. They notice my EKG is showing that I have a high heart rate and that I have some pressure that's not normal with what I've been showing. And I get an x-ray. That was maybe an hour and a half into the ER. And in the x-ray, that's where they saw it. So I started off with a 5x5 plus by 5 mass on the center right of my chest. The x-ray, though, doesn't show that. It just kind of shows this mass in that area. Then there was silence, I think, from the ER team. I didn't see a lot of them after that initial kind of picture. They told me about it. Got a lot of tests to run. The visit to the ER goes on. I'm texting my wife that there's something in my chest, and the ER physician, one of them comes back. This is probably 5 or 6 hours into my stay there. And they said that there is something that's in your lung area. We don't know what it is yet, but when the tests come back, we'll have some more answers for you. It's getting later in the afternoon, heading into the evening time, and they come back in. This is maybe an hour or so after that conversation with the x-ray. And they said that the tests have been run, and the ER I went to was here in Virginia at a place called Fort Belvoir, and didn't know this at the time, but before they head towards surgery, which is where they were thinking they were going, because this mass was pressing on my heart, that they get looked at by their higher hospital, which is Walter Reed. And on 4 October, the oncologist on call for this, we're going to head into surgery with an individual with a mass, is a guy named Dr. Kern. And Dr. Kern says, I want you to test for 2 particular proteins, the AFP, HCG. And they tested them and both were elevated. And that was the stop. no surgery. You have testicular cancer. Even the physicians at the time said it, but they said there's more that needs to occur in order to really definitively say that you have testicular cancer. But we're not doing a surgery. You're on a plateau level. It doesn't look like anything's causing your heart to have issues more than what it will be come Monday when you're going to go to Walter Reed. And that evening, I get home. It's maybe 8 o'clock at night, and I get a call from Dr. Kern. Him and his fellow doctor in the urology oncology department, Testes Center at Walter Reed, said, Andrew, you're not going to understand it now, but you have testicular cancer, and I want to see you Monday morning. I have everything I need to know to show that to be true. And then off I went.
Wow. It almost makes me like a little misty-eyed just because knowing Dr. Kern and he's such like a great guy, and, just him kind of, I guess, being the savior in that moment was kind of amazing.
It was. It could have been another oncologist that might not have had some reference in his mind of this is the way the disease can show itself. But it wasn't. He was the one that was on duty, and he was asked, and thank God that I didn't head into surgery right away.
So that appointment that you saw him on Monday morning, tell me about that one.
Yeah, so that was me, my wife, Kate. We went in Monday morning. By that point, we had looked up testicular cancer. We had seen the 95% cure rate, knowing it was not lung cancer, was something that made at least Kate and I feel better, because we had started right away Googling, let's look at the percentages. Let's figure out what reality is going to be for me. We go in Monday, and I end up meeting my case manager who's still with me, these many months later in terms of monitoring me. And I meet with Dr. Kern, and Dr. Kern then gives his perspective of this is testicular cancer. Testicular cancer has a very high cure rate. Yours does not. Our studies show that it's the numbers he gave me was a 40 to 50% alive at 2 years, poor prognosis. And he was the gentleman that was very straightforward about it. I appreciated that as a fellow military man. He said that there is a regime and a way in which we can move through this that gives you the best opportunity for success. And he said, sign these documents. Let me talk to you about what VIP is, Vice BEP. And VIP is what Indiana University recommends. It's what the standard of care is for you. And that's where I want to take you down. And then we'll see what occurs from a refractory perspective, how cancer responds, your cancer responds to chemo, and we'll go from there, but anticipate surgery at the end of this. I met with him, and I met with who now is, I would say, my primary oncologist, who's HEMOC, a gentleman named Dr. Bowers, who's also there at Walter Reed. And he came and talked to me. And unlike Dr. Kern, Dr. Bowers is a dark humor. We got this. It is no issue. This chemo, cisplatin, is just going to wipe away this. So it was very much back and forth for Kate and I that Monday.
So did you ever have anything that was on either of your testicles in relation to this diagnosis, or was it strictly up in your mediastinum?
I should have mentioned that. So with mine is primary mediastinum non-seminomatous germ cell tumor. And Dr. Kern mentioned on Monday, he said he's been through my I did have an ultrasound right before I left the ER that Friday. And he said he looked at it and double looked for testicular cancer, or even what he referred to as a burnout, that maybe it was there. Because if it started there, that changes the prognosis and potentially the treatment direction, because it originated in the testicles. He said he couldn't find it there, and it just didn't It didn't exist as far as he was aware and what has been shown these number of months. I'm a primary mediastinal. Well, the numbers he gave me was if 3 to 4% of men are potentially going to have testicular cancer, less than 1% of that number and ladies have it this way. Yeah.
Wow. All right.
So he was looking for it. He was trying to find it, just to say that it wasn't going to be what I have.
So at this point, you still have both your testicles. You didn't have either of them removed?
Neither. Nope. Still have them all. I have a little bit of my right lung that was removed in the surgery. Dr. Denlinger at IU said it was about a Oreo cookie, and I have a little bit of the sac that's around my heart, about the size of a thumbnail, that was removed, and then the residual tumor itself.
Let's talk about your VIP chemo. What was your experience like with that? What was the, so you had 4 rounds. Was it the same kind of week on, 2 weeks off, or how did that play out for you?
That's correct. So I signed the document 7 October. I had, and this is a blessing for sure, 7 October, we're finishing up the day with Dr. Kern. I hear him kind of aggressively talking with the case manager. If we don't get a port in by Wednesday, I'm going to be down there to talk with surgery. So I get my port in on Wednesday. It was a port on my left side. And then I started chemo the following Monday. So 14 October, I start. And it's just like you said, the etoposide, phosphamide, cisplatin. I arrived on Sunday. I go Monday through Friday. That first week was all 3. We'd start at maybe 8:30 in the morning, 9 in the morning, end about 8 at night, and then just recover during those next 2 weeks. My first week, I was in some pain in my left side and in my left arm. In fact, my left arm started swelling a little bit. It was a nurse, not a doctor, that kind of caught me looking at my hand a lot. Like, do you feel something? I said, I do. They ended up getting an ultrasound, and I ended up having a blood clot that had formed somewhere in here. I don't know the word of it. And although the chemo was being put in, it did something that made it to where before my second round, I had to get this removed. So I got left port removed, right port put in. So I've got 2 nice scars here at this point. And so I moved through that, 2 weeks off, seeing a lot of your earlier videos. After that first round, I was like, this ain't okay. I got this. And I think most of us feel like we got this, but week 1, it's like, well, that's not that bad. As it progressed through, I find myself now I'm heading into the 4th week, missing all my hair. I went from 205 down to 184. I'm having had a hemorrhoid. I had to get platelet transfusions along the way. I had to get red blood cell transfusions along the way. But another blessing is my regime, it stuck. So every time I needed to hit 1 week, 2 weeks off, it was all the way through from October 14th until the week before Christmas. And although that final week I thought was pretty interesting, because I swear I slept from maybe 10 in the morning until 2000 or 8 o'clock at night. And then I'd wake up for half an hour, drink a little bit, and then fall back asleep. I was just sleeping the whole time. Just very tired.
Yeah. So you mentioned, you mentioned the first week and maybe the later weeks you arrived on Sunday. So were you inpatient for your chemo, or did you leave?
Okay. I was inpatient, and that's regular with VIP. I know that there are some individuals that don't have to do that, but my HEMOC doctor, Dr. Bowers, said it's best because I think it's the etoposide, where the bleomycin, I think, or I don't know if I said that correctly. I didn't have that. That can affect lungs. With this type of cancer, they know the surgery is probably going to happen. It's the recommended step. They really want to guard your lungs through the process, but etoposide can affect your kidneys. So when not receiving chemo, they very much are just pumping you full of liquids. In fact, my fourth round, I was getting saline drips every day into the night, every day into the night, just flushing, flushing, flushing. Because anytime that they would see little red blood cells in my urine samples, they had a threshold that they wanted to stay below. And if it was above that, they would have to start adjusting what I was receiving. So they were very much, we want to keep you hydrated all the time. And I think they did that.
So were you, did they have a catheter in you during your weeks of chemo, or were you able to get up and go to the bathroom or fill up those jugs for them to take the samples?
That's right. It was a lot of bathroom breaks. I was told by Dr. Kern that this is before it started. He said there's a lot you can't control, that you're going to go through this process that you've agreed to, and that's the best opportunity for your success. But you have zero control of how the chemotherapy is going to interact with your cancer. You can go, he told me, he goes, you can go out and do 30 pull-ups right now, and it won't matter. However, the way your other organs and the way your body responds, you still have control over. So walk, get up, you use the bathroom. Don't try to hold. Tell us everything that you feel that's going on, because that you can still help. So I'd go walk whenever I could, even though I had the little cart with the bags, just to try to continue to keep my body moving, and using the bathroom all the time. I feel like it was every 10 or 15 minutes sometimes I'd have to get up and use the bathroom.
And flush twice, right?
That's right. Yeah, that's right. You got this little, whenever you have visitors, you have to put the little piece over the toilet so they don't get whatever the chemo is on them. And yeah, that's right.
So being in the Pentagon, you're not boots on the ground anymore, at least. So were you able to continue working, or were you off this whole from October to just before Christmas?
I went off. In the military, you have this interaction, at least within the Marine Corps and the Navy, where the Navy recommends, it's called a limited duty status. And that can be just a mark in your profile that kind of says who you are, all the way up to you're not going to work. And another blessing of, I've heard now that at the cancer center quite often, the blessing of cancer, at least in my story, when I had cancer, I was off work that entire time. Not only do I think I don't know if hearing some of the gentlemen that talk on this, that they were able to keep going, hats off. For me, I don't think I would have been very useful, especially towards the later sides of chemotherapy and then post-surgery. So I was off from October until May, no work at all. Not only was I think that the right medical decision for me, Dr. Kern, on that first day, 7 October, after that discussion of the prognosis, he said, enjoy yourself. Don't stress yourself out. Do the things that make you happy. Not because I think he was being fatalistic, but it is what it is. And this is what we got to deal with. So spend time at home whenever you can. Yeah. What he said, if you don't want to do the laundry, don't do the laundry. Just try to get out and walk, be with your family. And so the military, and at the Pentagon in particular, at least with I'm currently at, they placed me on a 6-month, we'll see you when you're better. Even my boss said that to me, because when you get better, we'll see you at work again.
Nice. Okay. You seem very warm and friendly. So I don't know how you are with your kids, but did they see like a softening of their Marine dad when you were going through this? I mean, how is it with your kids?
So my two oldest, I actually just had them, and we talked about it. We just had them go and visit a social worker therapist. Something I found with the kids along the way, and again, they're 15, 12, and 10, is I don't think my 10-year-old knew that I had cancer. He knew I was sick. My 15-year-old knew what was happening. And He was very much worried that first drive into VIP chemo. I remember driving to Walter Reed from here. But once the tumor started showing response and my nurse or Dr. Kern or Dr. Bowers, my HEMOC, or Dr. Ryan, my other part of the team, would start saying positive things like you're in a good spot, but you're not out of the woods. As a 15-year-old, I felt like he was very much everything's good. And even to this day, I think most survivors kind of have this idea in the back of their head, let alone when you're going through the treatment. Every day could be I'm off the rails mentally or physically. So I don't believe that they saw a different side of me. I think that they understood that I was sick. My son understood it was very serious. My 10-year-old, not as much. And my 12-year-old, I think he was probably somewhere in the middle, like a middle child. I bring up the therapist, though, because I'm not sure what's going to happen 10 years from now and the effect of them going through my treatment and disease. And I'm not good enough to know. So had the opportunity to take them. The Testes Center set it up for me at Walter Reed, and they seemed open to the idea, so we took them.
That's awesome. And it's great that the Testis program would set that up too. So, I mean, again, Dr. Kern just thinking of everything. So with them all being boys, what does it look like as far as, you letting them know that they're maybe at an increased risk?
So my middle son, he struggled with that particular idea more than my oldest. So he now, and it's very sad, that he will say, I feel a lump. And okay, so we'll talk about it. I thank him for letting me know, for letting Kate, my wife, know. How long has it been there? Well, I felt it today. And then a few days later, it won't be there. So he's very much aware of that issue. We've set up a calendar. I'm looking at my phone below me. We set up a calendar every month. We say, just check. Probably because I'm still fresh. I've only been no evidence of disease since March 7th. So it's, in my mind, it's still very much something that I'm thinking about. I assume that that'll slowly dissipate for all three of them. But Dr. Kern has told me that they're at an increased risk of testicular cancer. He said it's not some massive number, but it's something because it's there. You had it. Another blessing is he said that there's no study that shows it'll present the way mine is presented, which I'm not saying I'm happy about, but I don't want them to have to go through this or any testicular cancer. So we try to make it something that we do monthly. I don't want to say it together, but around the same date. Everyone go check. Tonight's the night. Go check.
That sounds like a perfect way to handle it. So even like after you retire and whenever that is, are they able to go see Dr. Kern at Walter Reed or whoever succeeds him? Or will they go? Am I asking a good question?
Yeah, I think that's a good question. It gets into once you retire, if they're still in college, if they're still a dependent of mine. There will be a time though, unlike I'm at 19 years now. I still got more left in me, so I'm not looking to head out at this point. But for them, they'll have coverage medical wise at Walter Reed or wherever it is that we go. For as long as they're dependent of me or going through college or an advanced trade school. Once that's over, so is that. And they'll have to move on with their own TRICARE benefits. For my wife and I, we don't have an anticipation of leaving the National Capital Region anytime soon. And Walter Reed is the best spot in the DoD for our type of disease. So I plan on sticking out around here and going there as long as they tell me to come.
For sure. Let's talk about the surgery that you had after chemo. What was so it was anticipated that you would have it. And then, what was the timeline? You finished chemo right before Christmas.
Right.
Then when was surgery?
Yeah, so looking back at it, I think it's kind of interesting that Dr. Bowers initially he was my hematology oncologist. He goes, let's not talk about surgery yet. Cisplatin is so powerful that it might go away. Dr. Bowers, the urology oncologist, was saying surgery is going to happen. That's what we need to plan for. And over the course of chemo, there's this switch that happened where Dr. Kern saw such a response with my disease that he said, maybe it's worth just watching for a little bit. Where my hemoc oncologist was very much like, there's still something there, let's get it out. And post chemo, the goal was for me within 7 to 8 weeks, we conducted the appropriate surgery to remove the remaining mass that was in me, which it went from 5 by 5 plus by 5 down to 4 inches by a little bit over 1 inch by a little bit over 2 inches. So it was still there. There was definitely something there. And by the way, there's no biopsy. So we don't know what it is, but we know it had a great result and it wasn't growing. My HCG and AFP all normalized after the second week of chemo. So we prepare with Walter Reed to get the surgery done. And I know Dr. Kern's perspective on IU. And my nurse case manager said, ask for a second opinion from IU if you want it. There's nothing saying you can't. So although I respected the team that was there at Walter Reed, Dr. Kern said, no one here has operated on this type of tumor. You might want to consider IU. He said that he had complete faith in the surgeon there, that he'd seen the work that he had done, but he hadn't worked on this. So all that together, I asked for a second opinion. Walter Reed team, the CT surgeon, that cardiothoracic surgeon that was at Walter Reed, very supportive of my desire. Out to IU for a review, and Dr. Dindlinger, who ended up being my surgeon, reviewed all the images. He had me, this was around mid-January, go through an MRI. And heading into the surgery, it was confirmed there was no metastasis that had occurred. The tumor itself had not invaded, not even local metastasis or far away. It was just there. It was showing some connection to part of my lung and a little bit to the outside sac. He goes, I can do this. And so out we went with, again, normalized blood markers, no metastasis, no growth. Kate and I went out to IU February 15th or so, February 14th. We just hit the 8-week mark, which is what Dr. Kern wanted to see. And I went in on a Monday. We did the pre-op, just kind of talking to me about what it's going to be like. And then Tuesday, I find myself on the slab. There was a potential for a VATS, which is, I think it's the robotic, we can go in from the sides of your ribs. And I might have messed the acronym up there. But Dr. Dindlinger and IU said the best results they've seen is a full sternotomy. So we open you up and we take a look at everything in there and we test anything that looks off and we take everything out that looks off. And that's what I ended up doing. So I got a pretty good scar now that I know that the radical, our RPL&D have some good scars here, but we tend to have the good scars up here. And they opened me up, took me out.
That's crazy. So does the military insurance cover you at IU, or does your wife have supplemental insurance? I know, like for me, I was obviously not in the military, but I was 25 at the time. I was on my parents' insurance. My dad's didn't cover out of state. My mom went full time at her job, got, the insurance that we needed. And then we went to IU. So, how was that for you going from Walter Reed to IU?
Seamless. Once the referrals were in and the CT surgeon and team at Walter Reed concurred with IU's recommendation and the recommendation, head out to that center of excellence. It was transparent. I don't know if every single hospital in the country accepts TRICARE insurance, but IU certainly did. So out we went.
Perfect. So you said May you were no evidence of disease?
March 7th.
March 7th. Okay. So you're, at the time of recording this, over 3 months. When it comes out, almost 4. How have those months been? Mentally, physically?
I think one, and this goes out to the hemonc oncologists out there listening, I think chemo is harder than surgery, even though I think that, for me at least, I think that there was just such a loss of strength over time with chemo. Whereas cliche as it sounds, after the February 18th surgery, every day got better. That being said, I just started running again this week, and I enjoyed running before the diagnosis. So it's been a slow recovery, but part of that is because I've tried to listen to what the doctors said in terms of take your time. For me, with IU, they recommended no more than 5 pounds for 6 weeks after surgery in both hands. And so you just can't lift much. You're also kind of in this like hold over feeling all the time, kind of guarding your incision site. But it gets rapidly better. As I'm talking to you now, I definitely have neuropathy in both feet. That did not show up until well after chemo. I'd say right around the time my surgery occurred. But it's not a pain, it's like a numbness. And I have a little bit of tinnitus that occurs, but it's infrequent. Once every few weeks, I'll hear something that'll go away. Mentally, I don't know, and there's so many survivors that have much more experience than me. I don't know if it's a realistic hope to say I'll stop thinking about cancer. I'll stop thinking about this prognosis of 40 to 50%. I'll stop thinking about relapse. And I'm saying that now because I think about cancer every day. I think about it every day. So I think mentally I'm doing okay. I don't know if I'm what I was before, and I don't know if I should hope to get back to that. This was life-changing. It made me focus on my family much more. I don't know, you have more experience than me on that. Do you find that it does get better, really?
I think I'm in an interesting position, like where I do these interviews and everything. I'm constantly thinking about it. Somebody who has gone through it and, is the same amount of time out, they might not think about it as much. I will say that I feel like it gets easier. And I think once you reach that 2 years where you were given the 40, 50%, maybe you'll kind of breathe a sigh of relief. But, I think you'll always think about it.
And it's not that I want to think about cancer every day, but now when I go to work, and I still enjoy being a Marine, I enjoy being home more. And that was not with such clarity. I couldn't have said that back in August or September last year. It definitely refocused me and probably the things, not even probably, the more important things in my life. So if I forget about what I went through years from now, am I going to maybe fall back into this rut where I'm chopping at work every day? I don't know if that's actually a good thing. So I don't know. I guess I'm doing okay.
I'm going to ask a question, and if you think we should edit it out, we can edit it out. But now you said you were going to be in this submission in November, you're going to be a commanding officer. Dr. Kern mentioned that in his episode that this is the most common cancer in the active duty military. Is there any opportunity, or do you feel a sense of responsibility to kind of educate, the young guys that are under you about the risk of testicular cancer due to, whatever it is that is making it the most common cancer in the active duty military?
And I think, yes. So the commanding officer piece, because of just how I am physically, that's been moved to the side for whenever it might occur again in the future, which I was excited about. To your point, I think that where I am now with my career, that is happening already. I had a conversation just yesterday with two full colonels. So these gentlemen are probably 4 or 5 years my senior. And you can, as you're telling them the story about where you've been for 6 months, you can see it in their eyes that they didn't even think about testicular cancer as something that we get. I had seen, and I think Marines, I think soldiers, airmen, guardians, sailors, we're young, we're fit, so we've signed that piece of paper saying we're not going to get cancer, even though we've breathed in things that fire pits in Afghanistan or worked in industrial spaces and ships. There's just this belief that because we're in relatively good shape, can't happen to us, that 100% definitiveness. I think as someone in the military in my position, it's naturally, I just talk about it now. If you feel something off, just go get checked. You just don't know. I had no idea. So I do. I think there's something that has, again, changed in my view of the military with maybe this is another collateral calling for me to try to get the word out. Yeah, I agree with that. I probably should. It's a good thing we should do.
Yeah. And
You're doing it.
I'm not going to ask you to hypothesize, but I will say that a lot of the guys that have been on here who are, military or retired military, it seems like a lot of them have had ties to like working around airplanes. So I don't know if that's a risk factor. It's just anecdotally what I've seen on this podcast. I find it interesting. So I don't know.
Yeah, I think Dr. Kern mentioned at one of our meetings along the way of there's no study that he's aware of, and this might be dated, that says because of these factors, you now have testicular cancer. But at least in the military, there's an increased sign that this is occurring at a higher rate. The correlations, I think, can run from in the military, you're being seen by medical. Even if you don't want to, you're being seen. And maybe because you're in tune with your body, maybe there's more of an understanding when it starts to go awry, excuse me. I don't know. There maybe there's something there. But the opportunity in the military to be able to just tell a lot of people, check yourself, it's definitely there. Like you can look at a bunch of men and women and say, check yourself for something. And I say women again, and in the support group on Facebook, there's quite a few ladies in there that have went through this. So I don't know what could cause it. I still don't, but there's an opportunity that exists in the military that might not exist in the regular world.
Yeah, and we're just hypothesizing. We don't know the answers. What advice do you have for anybody who, let's say, specifically has a primary mediastinal tumor?
My first bit would be what Dr. Bowers told me somewhere along the third. This is like a quote that I know he didn't make up on the spot, but and I actually put it in the support group. I think for our form of the disease, with a prognosis that we have, it's very useful. That a prognosis is absolutely useful for everybody and absolutely useless for anybody. I think you really got to grab onto that thought of there's so much accurate information for us to read, but when you're in the way that this disease has presented, I think it's a strong belief to just go back to that's not you. That's not you. Google is right in line with that prognosis in terms of just searching for things. I think the first bit is don't believe the prognosis. Know what that means and then move on to your own journey. Just continue to come back to that. And that'd be my first bit. Second bit, I would say is just enjoy whatever opportunities you do have. You can still smile and enjoy your family, even in the hardest moments. You can really lean into that if you're able to. And then for me, I'll be very open about it. I definitely leaned into my faith that there's something here working that is out of my control. It was never in my control. And I'm just going to ask as much as I can for God to come down and help. I need help. And, maybe you can pull that even farther. You just be willing to receive help. Maybe it's not from your faith, but I assume you've heard this, that I didn't do much with my testicular cancer. I just laid in a bed and got pumped full of things. A lot of people helped me get through this. I was just there.
Yeah. Great advice. Is there anything else that you want to add that we didn't talk about?
I think that if I could look back again in retrospect to what I've been through, it was absolutely horrifying. It was life altering. To think about your life in just terms of numbers is very scary. And whoever you are, at whatever age you are, I think that understanding that's coming. At some point, somewhere in your mind, and there's going to be this fear of mortality. And I think that for all of us that are surviving it currently, it's okay to really embrace that as a reality and then attempt to make that next step beyond that thought, regardless of, I had a poor prognosis. 95% is a poor prognosis for somebody. It's 5%. Very scary, very scary. And I think embracing, owning that, and then moving on with it is a good thing. You got to.
Amazing. Are you open to people reaching out to you if they have any questions or want to, have a similar story they want to talk about with you?
Absolutely. Yeah. So I'm on the Facebook group that is there with your organization, Testicular Cancer Awareness Foundation. And then there's a primary mediastinal germ cell tumor group that I discovered because I went to the TCAF. So I'm on there. I think trying to be someone that has went through it, not through that person's journey, but at the very least can offer up that transfusions occur and chemo's tough, but then it ends. So yes, absolutely. Can I do some shout outs though?
Yeah, definitely.
Yeah, I'm going to read down some lists. I didn't do this. These people did, but Dr. Dinling at IU, Sean Kern, Dr. Bowers, Dr. Ryan, my testicular case manager at Walter Reed, who said she wanted to stay in the shadows, but at the very least, she knows who I'm talking about. And then just along the way, thanks to my kids and then my wife, she went through cancer with me, and I very much appreciate what she's done.
Perfect. Love the shout outs. Well, I hope to see you July 15th in our inaugural ballroom with Dr. Kern. I hope to see you in Boston, and maybe you can catch a Red Sox game if they're in the postseason at that time. And then I look forward to seeing your post about your 2-year milestone.
Oh, thank you.
Andrew, thank you so much for being on It Takes Balls.
Absolutely. You have a great day.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org.